Hello everyone, I'm Dr. Rezk from Rainbow Pediatrics, and I wanted to talk to you today about newborn care. Usually the first few visits are very important for baby care. We usually talk about things to watch out for in children after they're discharged from the hospital, whether they're full-term babies or preterm babies. We talk about bathing and skincare. We talk about breastfeeding and how it's important to breastfeed solely until 6 months of age, and how we introduce foods after 6 months of age and what types of food to introduce. We also talk about crying and colic, which an important cause for anxiety in mothers in the first couple of months of life. We try to rule out medical causes for crying and colic, and sometimes it's a way the babies express themselves. They cry to express themselves, and sometimes it's a release for the babies to cry, but sometimes it's something more serious, and we usually address what the most common problem of crying and colic, and whether it's a formula problem or a need for a change of formula. And formula fed babies, we discuss what is the best formula to be used for your baby, what will work with your baby best by collecting an appropriate history and a family history, and what allergies parents have, and what family history is there that will help us guide us to the best formula to work for your baby. Also, we talk about spit ups and reflux. These are important things that makes parents very anxious at the beginning, and we usually go through that and figure out what would be the best approach for your child. Nutrition as well. We do talk about nutrition, especially after the first 6 months. Usually it's indicated now to introduce food earlier in babies, and we do test for developmental milestones that will guide us to tell you, hey, you know what, you can start baby food early. You can start at 4 or 5 months. If your baby has more gross motor skills, that will help him with fine motor skills, and what types of food to introduce at that time. We should talk about sleep as well, because sleep is important for the baby at the beginning. Usually most babies sleep 16 to 17 hours a day. And usually it's not a big problem at the beginning, as long as the babies are feeding appropriately and waking up in between to feed and things like that. So we talk about different patterns of sleep for babies and what the mother should be looking for as warning signs. We do talk about teething and tooth care, and what should you introduce, and when should you take your baby to the dentist, and how should you take care of the first tooth, which usually appear between 4 and 7 months. How do you take care of these teeth, and how you should provide appropriate care for them. We also talk about warning signs of abdominal distension, umbilical hernias, things like that at the beginning, which are common problems in babies and we see every day. We talk about vitamin supplementation and when your child qualifies for vitamin supplementation. And we try to address common problems like fever, vomiting, diarrhea, bloody stools, abnormal rashes that may be a concern to a lot of parents. So please just call me if you have any questions or you need any more clarification about these points. There's going to be more videos to describe other problems that may face you as you're taking care of your baby in the first year of life, which is definitely the most important year in your baby's life. Thank you so much.